Hello everyone, welcome back to this video. My name is Kafi Sheikh, I'm a medical student and this channel is all about giving other people hope. Today's topic: what makes a doctor a great doctor? In my opinion, there are many who say a great doctor is someone who knows his medical stuff and knows how to treat patients, and the others say it's the one who is very empathic towards his patients. And in my opinion, it must be something that is a combination of both of them. And I'm gonna show you with the 5 following points what I mean by that and what makes a great doctor in my own personal opinion. First and foremost, the first point is all about your medical know-how. You have to know how to treat people in your own specialty, what you actually do. And if you don't, it's not a big deal actually, because this medicine is, in my opinion, a whole systematic thing. That means that if you don't know how to treat your patient with this particular issue, you can just look it up. You just look it up in guidelines, medical guidelines, or even better, you have older colleagues who work way more years than you and are much better in what they do, and they can teach you. Or moreover, or more like that, you can just ask your own nurses in your ward or ED, ER, or where you work, because they all know, the older colleagues and the nurses, the practical things and what you can do in particular situations. So if you don't know your know-how or your medical know-how, it's not a big deal, because you have some kind of backups that can help you out. But at the end, if you want to be someone very great and someone who is also very independent, you need to know your medical know-how, because you can't depend on the others for the rest of your working life. So point number 2 is something that is very dear to my heart, and that is about having a heart that cares for others. Because being a doctor is still a social profession. That means that you are working with people, and with different kind of people. Some are very compliant and work with you and are very patient for being a patient, and there are others who are not very compliant, or even are very difficult to handle. And you need to have this kind of heart that cares still for both of these kind of spectrum of people, because you can't choose your own patients, how they react towards you, how they speak to you, and how they follow your orders. That are all those things that you can't really control. But there is one thing that you can control very, very well, and that is your heart. That you still care for these people and you just want to help them, even though they are very disrespectful, or in a way better way, which shouldn't be a big problem, that are very compliant towards you. So don't mind those negative or thoughts or things or ongoing whatsoever that you can't even control. Just concentrate on the heart of yours that should care for others. So number 3, it's all about the point of being a long life learner. That means that there are many new many new methods to treat people in very new scientific ways, and you need to be someone who knows these things. But it depends on where you work. If you work in a little hospital where the main focus is on treating people with your therapies that you can offer, then it's alright. If you're working at a very big hospital even though a hospital that is aligned to a university, then you need to be someone who knows his stuff very well and learns new things every time, because every day there are new methods, new strategies to help your patients out, and you need to learn these and apply them to your patient, because the new things or the new ways are more likely to be way more efficient and way more durable for your patients. So, number cuatro. It's about the topic of being a very good or just a good communicator. And that's very, very, very important to me and very dear to my heart, because I've seen situations where the patient is very, very frustrated about their situation, and the doctor couldn't really talk to them very well, or just give them the idea that they don't really care about them, and that's very unfortunate, and it actually just makes the whole situation way more worse. And it's not very necessary if you just learn how to communicate very well as a doctor. And that's something that I want to do on this channel very often, and in the next upcoming videos. It's all about communication in a very medical healthcare section, or in the medical world, because I experienced those situations where I thought, man, we could avoid all of this if we just take care about how we communicate towards our people, or to our people to our patients. And that's something that I want to work on, especially for me personally as a medical student, but also just to make more awareness about this topic. And yeah, because a bad dog is someone who is quiet, and the worst one, as I mentioned, is someone who gives the patient the idea that they don't really care, and that's through verbal communication, or moreover, it's about moreover over body language. So, and the fifth point, and this is the most important point, because I was in this kind of situation as a bystanding student, and I couldn't really do anything about this, but it's about the point of taking off the fear of your patient. And this is something that really, really bothered me, and still bothers me in some kind of way, that we find patients in very difficult situations. There are, especially in the area of ER and whatnot, but in this kind of situation we find our patients in a very bad spot. They are frustrated, that they're frustrated. Moreover, they're more likely frustrated about this situation, that they, for example, have an accident or just had a bad diagnosis for their disease, and or bad prognosis in that kind of sense, and that frustrates them very hard. And when a doctor came who doesn't really take off this fear, and just really cares about transmitting the information to the patient, so this person knows what happens to them or what's gonna happen to them, it's very, very, very unfortunate and very sad to me, because we can speak about the emotional level of this patient, about their frustration, what we can do to help them, and just to take off this fear, or just giving hope to this kind of patients. That's something that I want to learn, because there's one doctor who can do it very, very well. We are not best buddies, we're never gonna be, but he's a great doctor in these kind of terms, and he's a role model in this kind of topic. And I saw him interacting with his patients every time, and he can take off the fear of these patients extremely well. And that's something that amazed me very well. and that's something that I want to learn, and that's something that I want to communicate with all of you here, and hope we can see us in the next video that's gonna be about body language, because body language is very important. Many people are not aware of this, and yeah, I'm just a little geek about communication, so just bear with me or just follow me if you want to know even more. And I'm just focusing the body language or communication as a whole in the healthcare section or medical world, as you want to mention it. And yes, that's all about today, and see you next time.